Welcome everyone. Thank you so much for joining us today. We have Franchise Benefit Solutions here. They have worked with dozens of businesses, offering, affordable franchise benefits. So we have Bernard and Michael here who are going to give you some insight about what they offer. And then anyone who's not able to make it or needs to hop off, we will have a recording. We will send this out to the network. So no worries if you have to miss it. But Bernard, I will pass it off to you now.
Okay, Michael, go ahead.
Good afternoon, everyone. I'd like to thank everyone for joining us for today's webinar. A couple housekeeping items as we move into today's webinar. As we've already alluded to, this is set up as a webinar. Everyone is muted. That is an attendee. So if you do have things going on in the background, that is completely okay. Throughout the webinar, if you do have any sort of questions, we do encourage you to input those in the Q&A box. That seems everyone has already found at the bottom of your screen there. We will have a Q&A section at the conclusion of the presentation. And I believe we've alluded to this as well. This webinar is being recorded and will be sent out for everyone to receive at the conclusion. If you do have any questions, like I said, please feel free to put them in the Q&A box at the bottom. Otherwise, I will turn this back over to Bernard.
Thank you, Michael. And Tina, good afternoon, everyone. Over the next 30 minutes, we're going to cover facts about franchise benefit solutions, some of the challenges facing you, the franchisee, why offer benefits to your employees, our program advantages, our products portfolio, our enrollment platform and how it works with you, key provisions of the Affordable Care Act, solutions to help you hire and retain employees, and as Michael mentioned at the end, questions or comments. With over 40 years of experience specializing in customized benefit programs to the franchise community, our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Best Life Brands, Five Star Franchising, Valpak, Grocery Outlet, The Joint Chiropractic, Jenny Craig, Miracle Ear, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on and have expressed an interest in offering alternative benefit plans to help recruit and retain employees. Some of the challenges facing franchisees today: most franchisees lack the benefits to attract new employees. A lot of franchisees can't afford health plan options. Most franchisees, when they're new franchisees coming aboard, have limited benefits knowledge because they generally come from the corporate world and don't know how to handle the back office. And finally, ACA compliance issues for franchisees with over full-time employees. Let's talk about offering benefits to your employees. Employees are the heart of any great business, and key employees and leaders are essential to long-term success. Once you get a great team in place and they're performing well, it's a huge blow to lose any of your indispensable employees. Benefits are no longer a perk in today's business world. They're an expected part of compensation. Here are a few good reasons to offer benefits to your employees. Attract and retain your best employees. By offering a quality benefits program, you will attract and retain qualified candidates for your business and keep your best employees happy. Increase your bottom line. By offering benefits instead of higher wages, you win by having a lower wage-based match for state and federal unemployment taxes. Boost morale. By offering a benefits package, you've shown invested interest in your employees. In short, benefits can help promote good morale by keeping employees happier and healthier with less turnover for your business. Promote employee health and wellness. When employees have access to wellness, preventative care, doctor visits, and telemedicine programs, your overall business environment is healthier. Fewer employees are out on sick days and fewer people coming into work while ill. Equals increased productivity and profitability. Beat the competition in the race for talent. By offering the ACA compliant health plan and voluntary benefits, you can boost out half of your competition that do not offer benefits. And finally, create loyalty. Health insurance is an emotional offering. It says to your employees, you're a valued asset to this company and we care about your health and well-being. You're probably thinking, why franchise benefit solutions? What's the advantage of your program over other programs? Or what if I looked at similar plans on my own? First, we offer exclusive group plans and rates, all with guaranteed acceptance and no waiting periods. Our plans and rates are the same no matter where your franchise is located. If you have a franchise in Florida, Michigan, Washington, or California, the plans and rates are the same. We don't require employer participation or contribution. Plans can be employer paid, standalone, voluntary packaged together through payroll deduction. You choose the benefit you want to offer your employees, and your employees enroll online through our online portal. Our products portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. And as I mentioned, plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. Our benefits program includes 3 medical options: individual and family, comprehensive group, and voluntary group. For those franchisees that don't want to offer a group plan for their employees but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view on their own convenience. So basically, once you log into our portal, you input your information. Once you input your information, top plans from the local carriers will show up. If you're looking for a marketplace plan, it'll show you what your subsidies, as you can see at the very top here, and it'll show you from the lowest to the highest price. Again, you can compare affordable individual health plans from different carriers, find out if you qualify for financial help, view benefits at a glance, view local providers, and you can also apply online or download an enrollment form. If a franchisee is considering their group plan options, we can help them make the right decision that best fits their needs, their healthcare needs of their business and their employees. Group plans are based on the demographics of their company, along with their employee and dependents' ages. We would need census information in order to provide you with a group plan proposal. So there's 2 types of compliant plans, ACA compliant plans. First one is the ACA compliant, which we need a minimum of 2 employees. Plans are community rated. Rates are based on the group demographics and the employee census. Is not based on any health conditions. Carriers will accept eligible employee waivers. So if you have 20 employees and you have, let's say, 15 waivers because the employee has coverage with their spouse, with their parents, they have marketplace, any other type of coverage would be a waiver. And plans are guaranteed issue with no medical questions. There's also what's called a non-ACA compliant group plans, which was available prior to the ACA plans or the Obamacare. There we need a minimum of 5 employees. Rates are based on group demographics, employee census, and medical history. Groups can be rated or declined by the health carrier. Carriers will not accept eligible employee waivers. What's good about it is chances are premiums are lower, around 30 to 40%, with medical history. Our third and most popular option is our low-cost voluntary group medical plans, similar to an association health plan. The plans are a perfect strategy for franchisees focused on cost containment, usable daily benefits, and compliance with ACA mandates. The WellCare plan covers preventative services only, while the Elite Care plan covers preventative services, primary care, and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. The IHP plans provides more comprehensive coverage, such as in and out of hospitalization, emergency room, diagnostic testing, maternity, home health care, chemical dependency, and prescription drugs. So as you can see, from the WellCare plan to the IHP Prime plan, benefits are depending on what you want to offer your employees. Do you want to offer more coverage, less coverage? Do you want to contribute? It's really up to you. But our IHP plan, the IHP Prime plan, is our best, our top voluntary medical program. And then we can discuss further how the program is set up. So again, our plans are offering inexpensive alternative to high-cost medical plans. It satisfies the ACA and state individual mandates. Preventative services are covered 100% in all our programs. Services are provided through the National PHCS network. Same plans in all 50 states. IHP plans provide more comprehensive coverage, such as in and out patient hospitalization. In addition to our medical plans, we offer dental plan options. As you can see on the screen, we offer 4 different plans. For those in California, we offer a Delta Dental HMO dental plan where you simply pay copays. If you're not in California, we offer 3 dental plans through MetLife. Deductible are the same on all 3 plans. Even though it shows covered 100%, the deductible is actually $50 for an individual, $150 for family. Benefit maximum, the first 2 plans, Plan 3 and Plan 4, are pretty much the same. The only difference is Plan 4 covers orthodontia, where Plan 3 does not. The coinsurance levels are preventative services 100%, basic 80%, major 50%, and like I said, ortho covered under Plan 4, whereas Plan 3 does not. Plan 5 is the same as Plan 4. Other than Plan 5, the benefit maximum is $2,000, while Plan 3 and 4 is $1,000. So again, depending on what you want to offer and how you want to offer it, we offer several dental options. Vision is administered also through MetLife, but it is through VSP network. We offer 2 plans, a 1224 and a 1212. Eye exams on both plans are $10 copay once every 12 months. Lens, which includes frames and contacts or glasses. 1224 is a $25 copay once every 2 years or 24 months, while the 1212 is once every 12 months with a $25 copay. As you can see, the frame allowance, 1224 is up to $130, 1212 is up to $150. Our VSP plans also include national PPO directory retail chain providers such as Costco, VisionWorks, and Sam's Club. Vision is generally pretty low priced, around $6 to $9, depending on which plan you're going to go with. Life insurance, we offer 2 options. The first is a group life plan, which is employer pay, where if you have 10 employees, then all 10 employees would be required to enroll. It's a $10,000 option for all employees. Our second plan is a voluntary life plan, which is employee pay, not employer pay. Employees can purchase up to 5 times their salary, up to a maximum of $150,000. Spouse 50,000 or 50% max of the employee. And then dependent children, increments of 2,000 up to 10,000. Evidence of insurability is not required when you're first eligible. So if you have, if you decide to go with our program, your employees would not require any health questions when they're first eligible. However, if in the second year they decide they want to enroll, then they would have health questions to answer. This year, we're offering a new virtual primary care telemedicine program, 2 programs. One is the virtual urgent care, which is our 24/7 access telemedicine, where you call in the doctor, you're sick, you can't leave work, you call the doctor, they'll give them a diagnosis, they'll give you you give them your symptoms, they'll give you a diagnosis, and they'll even call in a prescription. It also includes virtual behavior health and on-demand counseling. This year, we're also having what's called a virtual primary care plan, which is similar for you to go in and visit your doctor. However, instead of visiting your doctor, you can have a virtual visit from home. It offers primary care physicians to provide personalized care through phone and video interactions, no matter where you're located. You speak to them, you can do a, on-demand or virtual, a physical, again, but you're not in the doctor's office, you're doing it from home, speaking to the doctor. They'll send you a lab and geometric testing kit, which is shipped to your doorstep. You prick your finger blood sample, send it back in a prepaid package. Once they receive it, your same doctor, your primary care doctor that you've assigned, will call you and review your physical and your blood work. Also includes on-demand counseling, therapy and counseling, psychiatric, chronic care management, and it also includes a prescription benefit. It has access over 70 generic prescription drugs at no cost to the member. I think the cost on this is around $11 a month, and it's for the whole family, not just for the employee. It would be for the whole family. We also have a hospital confinement plan. You have 2 benefit options. You can include this with your voluntary medical plan. The plan includes hospitalization benefits, treatment benefits for ambulance, hospital emergency room, doctor's office, outpatient therapy, diagnostic procedure, prescription drugs, routine childbirth, complications of pregnancy and lodging, inpatient, outpatient anesthesia benefit. Now, this benefit is paid to the employee. It is not paid to the provider. It's similar to a Aflac plan, but ours is with MetLife. So it does cover both injuries and sickness. Additional benefits, like I said, include surgery, anesthesia, diagnostic, pregnancy, lodging, and it can be received in a hospital emergency room or the physician's office. We also have an accident plan, which also includes hospital benefits, treatment benefits, covers accidental injuries regardless of other insurance. Benefits cover both inpatient and outpatient, covers more than 50 benefits. Again, it's paid to the member, not to the provider. Includes hospital admission, hospital confinement, ambulance, emergency room. It'll also pay a lump sum payment for fractures and dislocations. So, for instance, let's say you're in a car accident, you fracture your skull. It offers hospital benefits, and then it'll also pay a lump sum. So let's say a skull fracture up to $5,000. Also has dislocation lump sum payment. Let's say you dislocated your collarbone, it'll pay up to $1,500. Our benefit solutions for helping the franchisees. Our benefits enrollment platform includes 4 steps from the initial contact through the employee enrollment process, identifying your objectives, reviewing your benefit options, providing easy to understand benefits communication, and optimizing the enrollment process through our integrated portal. So from the first step, which is our discovery, would be the first conversation with you where we identify your objectives, determine your budget. We would gather information, and depending if you're looking for a comprehensive medical plan or a voluntary program, we will provide you with quotes. We'll also provide you with our employer guide, present benefit options, and formulate some type of benefits plan after you decided to enroll in our program. Once you decide that, we'll provide you with easy to understand communication. We may offer a benefits webinar for your employees. And while we're doing that, we'll build out our online enrollment platform, which ties to the communication. Michael, you want to explain a little bit of how our online enrollment platform works?
Sure. So the online enrollment platform, it's a fantastic tool that's really going to allow you to streamline benefits and allow you to do what matters the most, which is going to be running your own business. With the use of this online platform, all enrollments, terminations, adjustments, and changes will take place inside of your online enrollment platform. No longer will you have to go and have employees look through paper enrollment guides or paper enrollment forms that's sent to the insurance carrier. All of this is done directly inside of our online enrollment platform. Furthermore, once enrollment is concluded, all ID cards for employees are uploaded into their portal as well. So it becomes an all-in-one home for employees to review, manage, and see all of their benefits, their ID cards. And if they have questions, there is user guides, contact information, and links to help them as well.
Thanks, Michael. Just as a side note here, we had a group come to us, I think it was about 2 weeks ago, that had a similar program as our program. And what brought them to us was the online enrollment. The administrator of this one group was handling all the paperwork. They were taking waivers from the employees, and rather than have all the handling all the paperwork and keeping it in files, they using our enrollment platform, they're able to handle it all in one spot, not worry about the employees' enrollment. They're able to look at which employees are enrolling, which haven't done anything, and follow up with employees, and actually even download reports. So with technology these days, we're finding a lot of employers are looking at our format because of how our enrollment process works. Thanks again, Michael. Turning to the employer mandate under the Affordable Care Act, we get questions on this on a daily basis. The individual mandate no longer exists in most states. Individuals are not penalized for not having health insurance. The employer mandate, however, maintains or remains in place, and don't expect it to be repealed anytime soon. Here are a few provisions of the ACA and how it may affect you. A full-time employee is an employee that works at least 30 hours. We get calls on a daily basis. Our number of hours, our full-time employee is 40 hours. However, under the ACA, that employee must work at least 30 hours. Benefit waiting periods must be 90 days or less. Again, phone calls coming in, 6 months or a year wait. Again, under the ACA, benefit waiting periods must be 90 days or less. Now, you could have first of the month following 60 days, which could be 90 days. So again, under the ACA, benefit waiting periods cannot be any longer than 90 days. Employers with less than 50 full-time equivalent employees are not penalized for not providing health insurance. So if you have under 50 employees, you do not have to offer health insurance. Now, we've had employers that have reached out to us that have around 75 employees, but they only have 10 full-time and the rest are part-time or variable hours. Again, depending on the number of full-time equivalents. So if you have, let's say 70, 60 part-time, 10 full-time. So you've got 10 full-time, 60 part-time, and generally what we look at is 2 part-time equals 1 full-time. So we could say you have around 40 full-time employees, which means even though you say you have over 50 if you have over 50 employees, you're at 40 full-time equivalents or roundups. So, reach out to us and we'll help you on where you would stand with the 50 full-time equivalents. Now, if you have over 50 full-time employees or 50 full-time equivalents, you must provide health insurance or pay a penalty. Again, we do get calls on companies that have over 70, 80, 90 employees and know nothing about having to offer benefits to their employees and have not even received a penalty notice from the IRS. So buyer beware, if you get those letters. We do have a ACA colleague on staff that will work with you and helping you set up a program and help you with avoiding any type of IRS penalty. So again, under 50, you do not have to offer health insurance. Over 50, you do have to offer health insurance or pay a penalty. So let's take a look at what our most popular solutions over the years that we've worked with franchisees that would help you hire and retain employees. So I've listed what we think here at our sales team are 4 most popular packages. Package 1 is where the employer offers dual voluntary medical plans and contributes towards the employee-only cost. Then the employee contributes the balance of the employee cost plus dependent cost and any buyout plan. Employer offers additional voluntary benefits to 100% employee pay, and that includes dental, vision, voluntary life, telemedicine, accident, hospital confinement, and short-term disability. Now, as you can see, I put the hospital confinement in bold, and the main reason is the voluntary medical plan, let's say the low-end plan, you include the hospital confinement plan. It provides employees more healthcare coverage. Package 2, the employer enrolls in a management-only comprehensive group plan. Again, management only, whereas the employer contributes 100% towards the ownership, 50% towards management, and non-management, they don't contribute. And as you can see, what we've done, we've set up different classes, and I'll go over in a second how we set it up. Then the employer offers additional voluntary benefits to non-management employees at 100% employee pay. Package 3, employer enrolls in a comprehensive group health plan. Employer offers dual medical option and contributes 50% of the employee cost of the lowest plan. So you offer, let's say, 3 medical plans. You offer to contribute towards 50% of the lowest plan. Employees contributes the balance of the employee cost plus dependent cost and any buyout plan. Again, it may seem difficult, but using our enrollment platform, it's a lot easier where the employee can take a look at all the different choices and then make their decision based on the plan and the cost. Then the employer offers additional voluntary benefits at 100% employee pay. And then package 4, which actually is becoming our package 1 or package 2, employer offers voluntary benefits to all employees at 100% employee pay. This is where all the voluntary benefits, again, are are offered to the employee, but the employer does not contribute. Again, you decide how you want to set it up. We can provide you with suggestions, which we do have. You decide how you have the total control, how you want to set up the program, and then we'll set it up on our enrollment platform. And then we'll send out logins and whatever necessary to your employees to advise them to register, go online and enroll. Now, here's a cost breakdown of what I've just explained. It's to set up the plan. Step one, the employer sets up a class of employees based on the job title. So class one could be ownership, class two, management employee, and class three, non-management employee. Step two, employer sets up a comprehensive group plan for ownership and management level employees. Employer contributes 100% for ownership and 50% for management employee. Step three, employer sets up a voluntary medical plan for non-management employees at 100% employee pay. And then step four, like I said, employer offers additional voluntary benefits to all employees at 100% employee pay. I will tell you that, with all the groups and clients that we've enrolled over the years, 90 to 95% of employers will not contribute towards the voluntary benefits. And what I mean by the volunteer would be the dental, vision, hospital, etc. If they're going to contribute, they will only contribute towards the medical. So if you're thinking, you haven't set up a program, how do you set it up? Think if you're going to contribute, you contribute towards the medical plan, but the additional benefits, I would strongly suggest have the employees contribute, not you, the employer. So looking at the monthly cost, just an average, now this is an example. Let's say the owner, age 55, looking to set up a comprehensive plan through United Healthcare, which is a PPO plan, $2,000 deductible, 80/20 coinsurance, $40 primary care physician, $50 urgent care, and a $15 prescription card. Monthly cost could be $885. The employer would pay the whole premium. Management employee, age 47, also with United, same program as the owner. However, the owner decided to offer them the $5,000 deductible instead of the $2,000. The cost is $657, whereas the employer would contribute 50% and the employee contribute 50%. And then the non-management employees, this is an age 35-year-old through the voluntary medical, $15 office visit, $50 urgent care, and 15 prescription card. Monthly cost $118. Employer does not contribute. Employee would contribute 100%. So again, this is only an example. We can help you set it up. You'll understand how the whole program works. And again, promoting our enrollment platform, the employees will understand exactly what their cost is. If you are contributing, the employee will not see what you are contributing. They will only see what their cost is. And next, finally, we come to the questions. Michael, if you want to read some of the questions, I could go ahead and answer them.
Sure. At this time, if you do have any questions, please feel free to enter them in the Q&A button at the bottom of your screen. The very first one is there a waiting period for employees, or can they sign up for benefits from day one?
Good question. It's they can sign up from the time that they're hired up until their open enrollment period, and it's based on the waiting period from your employer. So again, your employer sets up the first of the month following 60 days from the date of hire. That means that you will have that waiting period to enroll. You will need to enroll by then. Now, as the employer, you want to make sure that you offer the employees, that you set up the program right at the beginning. Let your employees know at the beginning when they are hired or during orientation, because we do find some employers don't acknowledge that, and they will wait the last week before the benefits are supposed to start and let the employee, hey, you can sign up now, but that is not true. And then sometimes the employees will miss the open enrollment because of that. So again, you want to make sure that when you hire or when you first implement a program, that you want to let your employees know at the beginning, time to enroll, you have a certain amount of days to enroll. Go ahead, Michael.
Next one is, how long does it typically take to get set up with the benefits?
Generally, if you're looking at a voluntary program, we can get it set up the following month or the month thereafter. Again, it's all going to depend on working with you, you're working with us, providing us with the information that is required to set up the program and move forward. But if we get all the information from you and get everything set up, we can set it up within the following month or the month over. Now, I will tell you that our program, our carriers are integrated with our carriers. Some of our carriers are going to request that we have the information to them, have it set up a month prior to the date of their effective date. Again, so we can discuss that further. So just give you a heads up here.
Next one is, since open enrollment is passed, can we set up something now, especially for existing employees, or do we have to wait until open enrollment period at the end of the year?
Very good question. We can set it up anytime during the year. Our program is on a calendar year. Matter of fact, part of our program is guaranteed for a few years. But as you can see on your screen, and I guess I should have shown this before, but how to reach us. Michael is our representative for Ace Handyman Services. There's his email, phone number. For more information, you can scan the QR code below. We will be sending out again the recording with contact information. You do not have to answer your question, you do not have to wait to the open enrollment period. You can enroll anytime through the year, and we welcome all phone calls.
Next one is, if we already have a plan and employees are enrolled, how is that handled? Is everyone treated as a new employee and have that 60-day waiting period?
Yes. Because you already have a program doesn't mean anything how our program works. So once you come over to our program, then it would all start again. Now, it would waive the 60-day waiting period. The employees, the initial employees, which through our implementation process, they all would have they would all be waived for the initial open enrollment. So all employees would not have to wait the 60 days. They could get started the first of the month of how you set it up.
Next one, if I already have a group program set up through the year end of 2024, can I add a voluntary program for new employees I hired during the year rather than put them on my group plan?
In actuality, you don't have to wait through the end of year end 2024. What you have is a rate guarantee through the year end of 2024. You can change any time during the year to a different program. However, if you want to add our program as a volunteer program and then at year end look at our additional part of the program, you can do that. So again, you decide how you want to set it up.
Next one, is there any admin fees for the employer?
Good question. We do get that asked because there are some companies that, for instance, ADP, there are admin fees for going with their program. The admin fee that we have is we have a billing fee since we handle all the invoices. We have a billing fee depending on the size of the employees that are going to be enrolling. The max is, I think, $40 a month or $25 a month. In addition, we do have a $100 setup fee. And the reason for that is we've had in the past where several employers are enrolling with our program, and then when it comes down to it, none of the employees enroll. So we've spent a lot of time and effort. So we do charge a initial $100 fee, and then we also charge a billing fee, and the max I understand is $40. So other than that, whatever the rate you see is what the rate it is.
Okay, that looks like, unless there's any last questions coming through, that will be the end of questions here.
Okay, Tina, do you have any final words here?
Hi.
Another one that just came in.
Oh, yep, I see it.
Next one is, if no employees sign up, does the employer still have to pay a $40 a month? And I can answer that one. So that one's for the billing fee that's monthly is based on the amount that are enrolled from your group. The only fee that there is the initial implementation fee of the $100. So that allows you to have the program in effect for 12 months. And once you do have any enrollments, that's when the monthly billing fee would come into play.
The other part of that too is we've had in the past where an employer is not able to have any employees enrolled. They pay the $100, and then when they come back to us and then they do have employees enrolled, then we'll waive the $100 fee. Okay, Tina, doesn't look like we have any additional questions. If you want to give the final words.
Yes, thank you so much, Bernard and Michael. And as I'm reading this, it looks like a couple more questions came up, but this recording will be available. We'll make sure we send it out to everyone in the network. And Bernard will include instructions on how to make contact with Franchise Benefits Solutions, and we'll go from there. So other than these last couple of questions that are coming through, really appreciate everyone coming on. Very exciting. I know several of you wanted this for some time, so we're really excited.
Thanks, Tina. I'll answer these, or go ahead and go over the question and the answer here real quick. If you set up a package and nobody wants to enroll, and is there a time limit to get started? No, our program is on an annual calendar year basis, so you can start at any time during the year. Just remember, if you enroll at the end of the year, let's say October, then your rates may only be for 3 months, and then we have another calendar year. So again, programs on a calendar year basis. It is a franchise program, so it's hard for us to have rolling rates when we're trying to offer, provide the same rates to everybody. Is the billing fee, next question, is the $40 billing fee is for each employee? No, it's just an invoice billing fee. So again, Michael and I want to thank everybody for joining the webinar today. Tina, thanks for the partnership. We look forward to working with Ace Handyman Services and all of the franchisees. Again, any questions, please reach out, and we'll get out the recording most likely tomorrow morning, along with our employer guide, so everyone will have the plans and rates and be able to reach back out to us. So again, good afternoon, everyone, and have a great rest of your day.